because employers pay for most of the health insurance that most Americans have before they get into Medicare, jobs are leaving this country. We can't afford millions of unemployed baby boomers. And who's going to feed them? I can tell you from my own experience, my company dumped all its middle-aged Americans. Yep. I've been living on my retirement savings, and I certainly didn't intend to retire before 65. I went without health insurance until I got into Medicare. It's the most precious thing I possess. I didn't have my life together, and because I went without it for 6 years, I've lost part of the vision in my eyes because I couldn't get surgery that I needed. And these specialists may see patients who don't have insurance, but many specialists' offices will not give you an appointment. You don't get past the reception if you don't have insurance. But most of all, we need people to have jobs so that they pay income tax and pay sales tax and not go into old age and poverty.
Don't you think we should honor the promises we've already made to seniors under Social Security and Medicare before we make new promises? And does it defy common sense to say that senior health care would not be hurt if the legislation pending before the Senate cuts Medicare improvements by $22 billion, cuts home health by $25 billion, cuts payments to hospitals, is all under Medicare, these are all the cuts. Payments to hospitals, $23 billion. Wipes out Medicare Advantage, so those 3 million Americans lose their coverage under Advantage. Cuts Part D by $10 billion. Cuts nursing by $15 billion. I'm reading from the CBO score of the Baucus bill. Cuts overall Medicare payments to hospitals by $76 billion. Cuts psychiatric services by $3 billion. Outpatient services by $8 billion. Hospice services by $8 billion, and durable medical equipment by $20 billion. You cannot make those cuts and say you are not harming senior health care in America.
Congressman, I just have a quick question about the reconciliation possibility as far as Congress taking that step to get this passed.
I think it's extremely likely that the Senate leadership will ignite reconciliation so that they can pass the Baucus bill with 51 senators. We've got 2 senators. 1.5. Yeah, I'd skip the call to Roland.
I hear so many things and read so many tidbits. I don't know enough to put all these things together. Where is the plan that you think is best for the United States? Where is it published? And is it less than 1,100 pages?
Right. If Shauna is standing next to you, she can get your email, and for anybody else, we can send it to you. We have, in the world of CNN and Fox, we have a 1-pager, a 3-pager, a 20-pager, and then the big kahuna if you want the whole thing. But it's a serious effort. When I got home from active duty in Afghanistan in January, I went to the Republican leader and I said, this is the biggest thing we will vote on in this Congress. He said, we don't have consensus here. I can't really work on this right now. We were in the middle of the stimulus. I said, well, given my experience, my first health care bill was when I was 18 years old as a junior staffer doing data for American Hospital Association in the late 70s. I said, this is so complicated, so big. Once again, we have to do it right, not quick. So when you take that task on, you take on 3 major tasks. 1, what's the right policy? What should we do? And we met with 6 patient advocacy, doctor, hospital, employer, provider groups. It took us 3.5 months to set forth the policies which I laid out. Secondly, we got to write the legislation. You do not write legislation like in a college dorm in an all-night session. For us, we took another 4 months to write our bill carefully with consideration. And then in the real world, of CNN and Fox, you then have to communicate it in 60 seconds. And for those of you who want, sign up at the back table, we'll get your email. We will send you the centrist healthcare reform bill, which we think is the best way to go.
Just want to address a few of the comments. In the discussion of costs, the insurance companies have taken a big rap here in this meeting. However, what about the pharmaceutical companies that spend millions on ads suggesting medication, say, go to your doctor and say if this works? What about the 19.8% profit that they have? What about the hospitals that are converting semi-privates to private beds, which cost about approximately $200 a day more, such as the Northwest Community Hospital, Lutheran General? I have never been, if you went over to DuPage Central where my wife had a knee replacement, if you took all the medical equipment out of there, it would be one of the best hotels in the world. I think we have to look where the costs are being driven up. My wife has neuropathy. We went down, she's been to 3 neuropathists and 1 anesthesiologist who injected her back with shots, and she still does not have a solution to the problem. Now, I'm not suggesting that these were incompetent physicians. I am suggesting, however, that some problems take a lot of money to solve. And then the last but not least, the American people are not cooperating. There are a lot of Americans in this state and all the other states that have bad habits that they will not quit. Is definitely going to cause some health issues down the road. And I could cite many of them, but I won't take the time. Let's look at the problem where the costs are, and I would challenge Dr. Alexander. I'd like to sit him down with a CFO of an insurance company and see if his statistics are even close. I doubt it.
Don't get chased, sir. I just say I agree with you on medical. Sean, then we go there and then the last one. Because you've got a U.S. Navy hat, I'm going to be favoring you. Hold on one second. I do agree with you, especially on medical ads. I think that's a change that we shouldn't have made. And we could save hundreds of millions of dollars if we don't have